Welcome to the TRICARE4U.com web portal tutorial regarding behavioral health. For beneficiaries with TRICARE for Life, WPS follows Medicare's rules for mental health care until the Medicare benefits are exhausted. Authorizations are not required if Medicare is primary. If Medicare benefits for inpatient mental health are exhausted, an authorization is required for inpatient mental health or substance use disorder. If Medicare benefits are exhausted, a referral or prior authorization is not needed for any outpatient mental health, except psychoanalysis, or substance use disorder care. If the treatment is from healthcare providers outside the network, this may result in higher cost sharing. Appointments may be scheduled with any TRICARE authorized healthcare provider. An authorized provider is any individual, institution, organization, or supplier that is licensed by a state, accredited by national organization, or meets other standards of the medical community and is certified to provide benefits under TRICARE. There are two types of TRICARE authorized providers. The first provider is a TRICARE Certified Mental Health Counselor, or TCMHC. This is a mental health counselor who is certified or licensed for independent practice. WPS does not require an MD referral or statement of ongoing communication. Requirements to become a TCMHC are listed in the TRICARE Policy Manual, Chapter 11, Section 3.1, or on the Mental Health Practitioner application form located on the TRICARE4U.com website. The second category of provider is a Supervised Mental Health Counselor, SMHC. SMHCs require an MD referral and statement of ongoing communication. The beneficiary may not self-refer to an SMHC. A full listing of authorized providers is located on the health.mil website listed on this page. A Medicare explanation of benefits will not be required for non-payable Medicare providers, but those providers must be TRICARE authorized. For services that require an authorization, the most reliable way for providers to send information is to use our TRICARE4U.com website to send the authorization request form specific to the request and accompanying documentation. There is an easy-to-follow tutorial for the provider on the Create a Provider Account page at the top right of that page. Always use the authorization request form as a cover sheet. To send by fax, fax the authorization request form and accompanying documentation to 608-301-3226. It takes at least 24 hours for the fax to get into our system. To send by mail, forward all authorization requests and accompanying documentation to Diffic MR Authorizations, 1707 West Broadway, P.O. Box 7934, Madison, Wisconsin 53713. It is not recommended to send to a physical street address, as the listed methods are the most reliable and efficient way to submit the requests. Retroactive authorizations are not provided. If the service has been performed greater than 5 days ago, the provider will need to submit a claim with supporting documentation for a review to the Claims Department via the TRICARE4U.com website or via fax at 608-301-2114 or 608-301-3100. There will be a payment reduction of 10% if an authorization was not done. When a beneficiary is covered under Part B services, a Medicare explanation of benefits is required for TFL secondary mental health services on an outpatient basis when provided by the following providers: doctor or psychiatrist, clinical psychologist, clinical social worker, nurse practitioner, psychiatric clinical nurse specialist, certified nurse midwife, physician's assistant in a doctor's or other healthcare provider's office or hospital outpatient department. Here is the list of covered mental health services that TRICARE will consider for processing. Take a minute to review this list before continuing with the tutorial. TRICARE also has exclusions, which are listed here for review. Take a minute to review these exclusions before continuing with the tutorial. The most current and full listing of TRICARE out-of-pocket expenses can be viewed at tricare.mil/costs/compare. Please be sure to like us on our Facebook page and follow us on Twitter. By following us, you will be able to see upcoming events such as tutorials and webinars and when they will be held, along with other educational items that may be of interest. Thank you for watching our tutorial.